All right, hello everyone. Today we're going to talk about hospital-acquired infections and how to stop them using evidence-based practice. So in this presentation, the student nurse will identify how hospital-acquired infections can be prevented in the hospital and other clinical settings using evidence-based practice. By the end of the presentation, the student nurses will discuss how their attitudes towards the importance of preventing hospital-acquired infections have changed by the end of the presentation. And the student nurse will demonstrate proficiency in implementing proper infection control measures to reduce the risk of hospital-acquired infections and how to prevent them at the end of the presentation.
So in order to understand, in order to prevent what hospital-acquired infection is, it is a non-communicable infection that usually patients acquire during their hospital stay. And that contributes to patient morbidity, extended hospital stays, increased healthcare costs. And these are some of the most common ones: surgical site infections, central line-associated bloodstream infections, catheter-associated urinary tract infection, ventilator-associated pneumonia, the CDI, and MRSA. If these infections are not prevented, it can contribute to patient distress, functional disorder. In severe cases, it can even lead to disability or death.
Just as a brief overview, hospital-acquired infections are a significant contributor to illness and death among patients worldwide. According to the World Health Organization, they estimate that annually hundreds of millions of patients suffer from these infections, which significantly contribute to illness and death. In addition to that, each year, healthcare-associated infections incur costs of approximately $9.8 billion, with surgical site infections being the most prevalent. They can also result in an increase in healthcare expenses and prolonged hospitalizations, which impact both developed and underdeveloped nations or developing nations. And then risk factors for these infections include the use of invasive medical devices such as catheters or ventilators, or the prevalence of drug-resistant pathogens within healthcare environments. These infections can also arise during the course of medical care for existing conditions or following a patient's discharge.
All right, so this is our KSA table, and this is what we'll be basing the rest of our presentation on. So we're going to start with the knowledge. The competency states that you will describe how hospital-acquired infections occur and what can be done to prevent them. For the activity, we will educate you on what the signs and symptoms are of some common hospital-acquired infections, inform you of what practices should be followed in order to prevent hospital-acquired infections. And so we chose this because hospital-acquired infections increase the risk of poor outcomes, increase patient stays in hospitals, and place financial burden on both the patient and the hospital. So a lot of the signs and symptoms of hospital-acquired infections are pretty similar to what you'll see with all infections. You got like fevers, chills, altered mental status, coughing, shortness of breath, abdominal pain, plain suprapubic pain, polyuria, dysuria, tachycardia, diarrhea, and hypertension leading to hypotension if it's left untreated. So hospital-acquired infections have major complications to both the patients and the hospital they are being treated in. It is estimated that patients that contract hospital-acquired infections have an average of 1 to 8 more days in the hospital. Untreated infections can spread to the body, leading to septic shock and organ failure. HAIs can also cause the hospital to have a decreased reputation, as people will be afraid to go to that hospital as they are afraid that they could also get one of these infections. It also creates financial burden for both the patient and the hospital due to increased costs for extra treatments and extra medications. And obviously, if this goes on for too long, it can cause death to the patient. So these infections are scary, but they can easily be prevented. The most effective way is proper hand hygiene, using tepid water or warm water and soap. You can also use an antibacterial hand sanitizer that's at least 70% alcohol. All medical devices in the environment, including the bedside table, should be disinfected. Proper use of PPE like gloves, gowns, goggles, all that type of stuff. Proper implementation of isolation procedures, like contact precautions or airborne precautions. If someone's on a ventilator, the use proper oral care is needed in order to prevent bacteria from growing and spreading. Doing a CHG bath at least once every 24 hours, as well as catheter care once every 12 hours, or if the catheter becomes contaminated, is a great way to prevent these infections. Making sure you're staying up to date on all infection control measures and being sure to stay compliant with hospital policies will ensure that infection is being prevented.
So this is the skills competency portion. So our competency is to understand the implementation, care, and skills involved with invasive and non-invasive care in the hospital. The activity would be to have a volunteer student show how to perform proper hand hygiene, just like we did back in fundamentals, discuss care needed for a patient with a fully invasive line and ventilated patients, and identify possible sources of infection and how to negate those. And then why do we focus on this? Focusing on these areas will help us improve one's understanding and skills in providing safe and effective care to patients with invasive devices, which will decrease the results of complications such as HAIs. So we're going to cover hand hygiene, daily communication, proper care, and PPE. So with hand hygiene, we're going to make sure that we wash in and out of every room using hand sanitizer, the facility equivalent, or wash our hands with warm water with antimicrobial soap for at least 20 seconds. So we're going to make sure that we wet our hands first, then we're going to add our soap and scrub our hands together, and then we're going to wash them together under the water for at least 20 seconds. Daily communication is important because the longer the line or the invasive line stays inside of the person, the longer they have to be getting infected. So communication for the need for the invasive line should happen after the first 24 hours. The bedside nurses should be able to identify and relay pertinent information after completing their morning assessments on whether or not the patient should still have said line. As far as proper care for each one of the invasive line surgical sites or ventilators, these are outlined in facility protocol and should be based on evidence-based practice. Evidence-based practice care for such procedures are covering central lines with CHG impregnated tegaderms, making sure that we're doing our Q2 oral care for our intubated patients, and then monitoring surgical sites for signs of infection, and then providing Foley care to those who have Foley catheters. Lastly, we have our PPE. PPE protects both the patients and the nurses from infections. PPE includes our gloves, our gowns, our masks, N95s, overhead respirators, goggles, glasses, and other protective equipment. PPE should be donned before entering a patient's room and taken off before leaving it. And then the level of PPE is determined by the infection that the patient has.
So for the attitude competence section is recognizing a personal responsibility in preventing hospital-acquired infection and committing into maintaining a safe care environment and empowering the patient to participate in prevention efforts, value evidence-based practice, and continue improvements in infection prevention efforts. For the activities to reflect on personal attitude towards the infection and preventing and commit to proactive measures by providing you with evidence-based strategies and prevent infection hospital, fostering a culture of reliance and best practice. The reason we're focusing on this is recognizing the value of evidence-based practice ensures that the infection prevention efforts are grounded in the most current and reliable evidence, resulting in strategies that are more effective and efficient. And encouraging patients to participate in preventing infection that creates a team-based approach to healthcare where patients take part in in protecting their health and well-being. Teaching patients about infection prevention methods like hand washing, as the other people have already mentioned, and identifying symptoms like symptoms of infections. For the activity, making effort to be proactive and take some time to review what you currently do and pinpoint areas where you can do better, reflecting on your actions to help you grow professionally and motivate you to make responsibility for your part in preventing infections, assessing how well you follow hand hygiene guidelines and use equipments and support infection control practices.
So when it comes to addressing this problem, this is a very critical responsibility within the nursing profession. We want to make sure that with hand hygiene, we're ensuring that all healthcare providers adhere to proper hand hygiene practices. When it comes to training, we want to do continual education and training regarding infection prevention practices and the most current evidence-based strategies. We want to express the importance of communicating and collaborating amongst all healthcare teams to ensure that everyone is aware and adheres to the infection prevention protocols.
So this is what we're doing to support our claims. So all of our points in our presentation reflect current research and data. All the sources that we have are from academic papers or articles written within the past 5 years from trusted academic sources or medical institutions. And for further explanations or more in-depth material, please refer to the reference slides at the end of our presentation.
So in conclusion, hospital-acquired infections increase the cost of care for the hospital and the patient, the length of stay, and patient mortality. The most critical information to retain from this presentation is that these infections are preventable. We can decrease the number of hospital-acquired infections by following proper disinfection protocol, performing hand hygiene, and using our knowledge of evidence-based principles to guide us in creating and implementing procedures that will truly help our patients. And now we'll review some of the information covered during the presentation. Participation would be appreciated. Questions are true and false, multiple choice, and select all that apply. If you have any questions, feel free to ask.
And I'm just going to kind of briefly show the questions and then the answers. You can pause the video and answer them on your own. So here's our knowledge check. Question 1, here are the answers. Question 2, here are the answers. Question 3, here are the answers. Question 4, here are the answers. Question 5, the answers. Question 6, the answers. And here are our references. All right, thank you guys.